In this video, we're going to look at how to speed up nerve regeneration after prostate surgery, or, major spoiler alert, if you can actually influence that nerve recovery at the nerve basis. And if you can't do that, what can you do to optimize your erection recovery? Hi, I'm Victoria Cullen. Over the past decade, I've worked with thousands of men recovering erectile function after prostate cancer treatment through my website, A Touchy Subject, and my private membership group, The Hub. I'm here to share with you what I've noticed works best to help you optimize your erection recovery journey. Let's start by talking about how the erection nerves actually work and what's happened to them during prostate surgery. So the nerves that have been affected during prostate surgery that are resulting in erectile dysfunction are called the cavernous nerves. These surround the prostate, and think of a really delicate, almost the thinnest piece of tissue paper that you can imagine, and it's wet and it is embedded onto the prostate. So these are really delicate nerves, run all along the prostate, and when the prostate is removed during surgery, even when those nerves are preserved, which is called a full nerve sparing procedure, the light and heat alone from that surgery sends those nerves into a state of trauma. After surgery, the process of those nerves waking up again from that traumatized state is called neuropraxia. So those nerves don't grow back. They're not growing more of what's there. It's what's left comes essentially back to life. It heals, comes back online to be able to complete the process of natural erection function. This particular nerve recovery process can take up to 2 to 4 years. That's a brief overview, but if you want to learn more about that specific type of nerve, the cavernous nerves, I highly recommend you check out the interviews I've done with urologist Professor Declan Murphy, located both on YouTube, and we have an awesome deep dive interview with Declan in the Hub membership so that you can understand more about this. So you're probably wondering at this point, well, can you speed up that healing process, especially if it's measured in years? That's a long time. Well, at this point, there's no evidence to suggest we can directly influence those nerves themselves, apart from nerve grafting surgery, that is, but that's a whole other procedure. And again, we have videos on YouTube where you can learn more about that. But stay with me, please don't run away at this point, because that doesn't mean that there aren't factors that you can influence to optimize your erectile function recovery. What I suggest in order to optimize your recovery journey is to actually turn your attention away from what those nerves are up to and onto the other two systems that are much more in your control. Maintaining the health of your penile tissue and practicing pleasure and arousal. Firstly, you need penile tissue to be in great condition to create erections again once those nerves come back online. If the penis is left alone without doing anything at all, so that includes if you're not experiencing nocturnal erections or morning erections or erections from arousal, you increase the risk of developing penile fibrosis. Fibrosis is the buildup of scar tissue within the penile tissue, and this can then result in Peyronie's disease. Those can be their own causes of erectile dysfunction. Essentially, to put it very simply, you've got to be taking care of the plumbing while the electrics come back online, or else you may end up with a whole new problem to manage. The process of maintaining your penile tissue health is called penile rehabilitation. Now, if the term penile rehabilitation is new to you, or you've heard it but you're not sure if you're doing it right, take our 6 key erection recovery principles free course, as this will guide you through all the options and how they all work together. Your second point of focus is pleasure and arousal. The reason for this is quite simple, but I still feel it's not being introduced to the conversation of rehab enough. During your waking hours, if you want to see whether a natural erection is possible, you're going to be making what I refer to as that sexy phone call from your brain to your genitals to actually see if the nerves are online. Pleasure and arousal are such important and I think often missing parts of this rehab conversation. But when you're learning to orgasm flaccid for the first time and you're not sure how intimacy is going to look when feel with your partner in this whole new paradigm, it can feel like those aspects of pleasure and sexual arousal may never come back in the same way. The good news here is your nerve endings love pleasure. Desire and arousal are not dependent on function, and through the power of sexual neuroplasticity, pleasure and orgasm can be practiced and heightened. We have lots of resources in the Hub teaching you exactly how to practice pleasure flaccid and how to reconnect with your partner again without any pressure on performance or outcome. Lastly, something I'm noticing in the Hub through our expert webinars are even more holistic ways to take care of your sexual system and overall general health to help enhance that erection recovery process. For example, last month we had oncology dietitian Dr. Crystal Zuniga join us for our monthly Ask an Expert Hub webinar. A Hub member asked a great question about what kind of diet best supports erection nerve recovery, and here's her answer.
So one is we do want to try to reduce inflammation. As long as there's inflammation, that reduces or the rate of healing. So how can you lower inflammation? Well, it's not from a supplement, right? It's kind of back to your whole foods, plant forward diet, because that is an anti-inflammatory diet. More plants, less processed foods, and especially focusing on those really antioxidant rich foods. That's going to include things like your berries, chia and flax seeds, walnuts, sunflower seeds, all really good sources of some antioxidants and some nutrients that help support our antioxidant system. And that's where we want to cut back on alcohol, simple sugars. Those are things that can increase inflammation, because physical activity and good aerobic fitness, that's improving your vascular health, that's increasing circulation. It's easier for nutrients to get to and oxygen to get to the site that it needs to get to, because those nerves are going to need energy. They're going to need those nutrients to help reduce inflammation. They're going to need oxygen. And so we want to make sure that you are taking care of your overall cardio fitness. We've also seen too in cancer survivors that after short bouts of physical activity, the immune system comes online and it starts mobilizing. And again, it can help clean up damaged areas, like, where you might have had some tissue damage from the surgery, and again, allows for things to recover. So it mobilizes your cleanup army as well.
So this can be a great example of yet another way you could positively be influencing your recovery. So where to next? If you're new to learning about sexual recovery post-prostate cancer treatment, please start with our free 6 Key Erection Principles course. This will give you the groundwork. If you're already doing a protocol, but you really want to fine-tune what you're doing and you'd like to have a community of encouraging, supportive men around you who are on the same journey, then please join the hub. We'd love to have you there. If you liked this video, please give it a like, and also thank you to everybody who has subscribed already to the channel. This makes a huge difference in helping tell the algorithm to send this video out to more men who need it.